Let me just say, this testing site is now open. This is the second Houston test site that's open, fully functional. We can do up to 250 tests per day, and it's open for testing from 11 till 7 p.m., 11 to 7. And so anyone who wants to be tested, if experiencing any sort of symptoms, fever, dry cough, tightness of the chest, you're eligible to be tested at this site. So there's no age requirement. You don't have to be a first responder or a healthcare professional, although they are always eligible to go to any one of our sites to be tested. So this is open to anyone who is symptomatic. As of about, 30, 40 minutes ago, where's Officer Harris? I think we've already tested over 170 already at this site, and again, it will be open until 7 p.m. The more testing we do, the better we can get a sense of the community spread that exists in the city of Houston. And as I've said many times before, we fully expect the numbers, people who have been confirmed with COVID-19, we expect those numbers to continue to rise each and every day, both in Houston as well as in Harris County, as well as the surrounding region. As of today, there are 48 more confirmed cases in the city of Houston. As you know, yesterday it was like 84. Today it is 48. So there are 48 more confirmed cases that will bring the count in the city of Houston up to 506. So 506 is a number roughly half of what was yesterday, but 48. And those numbers will fluctuate. Today is 48. Tomorrow it could be 100 or more. But we anticipate until we reach the peak, which, based on the medical professionals' opinions, what they're providing us, the peak could be somewhere around May the 2nd, somewhere in the first part of May is what they're saying to us. We expect those numbers to continue to rise each and every day as we do more testing. So I'm not so much caught up on the numbers. What is important is that we do everything we can to stay within our healthcare delivery system's ability to handle those patients that need to be treated in our hospitals, that we have the beds for them, both general admission as well as ICU beds. And so that's why it's so important to continue to flatten the curve. With respect to our death toll, we're adding 2 more to the list. Both individuals are one is in their 60s and the other is in the 70s. With underlying medical conditions. So 2 more deaths to report today. And with respect to the city of Houston, that brings the number to 6. So 6 deaths in the city of Houston, 6. And the goal is to keep that number down. You don't want to lose a single person. 1 is too many. But the number, 6 deaths in the city of Houston, 48 more confirmed cases today, bringing that number to 506. And so that's what we have. Again, talking to the medical professionals, in fact, earlier today, again, we are staying, below the ability, within the ability of the hospitals to take care of people who are coming to our hospitals. But we want to continue to be aggressive, to do everything we can to slow the progression of this virus. That is the singular goal, to slow the progression of this virus. Let me take this opportunity to thank Houstonians that are complying, because things are working. What people are doing is helping, and I want to take the opportunity to thank people for what they are doing. Let me thank you for complying, for working with us. As we drive around the city of Houston, for example, people are staying at home. We're telling people that unless you work for an essential business, please stay at home. And even if you go venture out to the grocery stores, to the pharmacies, please exercise social distancing, because that's what will be important, the social distancing aspect of this whole situation. I think I do want to mention, since this is the first of the week, we're asking landlords and tenants to work together. I do have a good report to make, because Camden Properties, which is one of the largest apartment complexes, not only in the city of Houston, but in the country, they have put together what they call their Camden Cares Resident Relief Program. They're placing like $5 million Camden Properties. As you know, Rick Campo is chairman of the Houston Harris County Port. They're placing like $5 million into this relief fund for their residents, and giving a grant of $2,000 to their tenants who have lost their jobs or their income. They're not charging any late fees, no evictions, and they're working out individual rent deferral plans, which is good. And so hopefully other landlords and others will do the same. So I want to give a special acknowledgement to Camden Properties and to Rick Campo. They have many apartments in the city of Houston. But again, no late fees, no evictions, and they're working out the rent deferral. And in addition to that, they're providing $2,000 to their residents who have lost their jobs and or their income. So certainly want to thank all of them. We are always in the need for more PPEs. So let me put a special request on that. You know, if you have PPEs, personal protection equipment, or you have access to them, the first responders and other people that are on the front line, our health department personnel, public works, you know, all of these employees certainly would be appreciative of it. And at this point in time, because you don't know really how long this is going to last, you can never have enough. And I know that both Chief Pena and Chief Acevedo, as well as Steve Director Williams, can speak to that in a short moment. So let me stop there for now, and let me bring on Dr. Purse, and he can elaborate any further if he wants to on the two deaths that we've had in there, the two in their one in the 60s and one in the 70s. Dr. Purse. Let me shift to the room.
Thank you, Mayor. So yes, we have two more unfortunate deaths to report. They're both folks, one is in their 60s, one is in their 70s. But we've seen this before. I don't want the public to be distracted. The elder folks seem to be the ones that suffer the greatest consequences of this virus. However, that does not mean those are the ones that are most commonly infected. Anyone of any age can be infected, and then of course they can then spread the virus to someone else. So all along, the mayor's been saying, don't pay too much attention to the numbers. We have quite a number of new cases today. 2 deaths within 24 hours. We've not had that happen before. This is not the trend that we're looking for. Each and every one of these deaths is potentially preventable if people would social distance, wash their hands, and do all those other things that we talk about. These are unprecedented times. We can get through this together. We need to pay attention, and we'll be successful.
Thanks, Dr. Person. Let me just emphasize, even though, you know, 2 deaths, today 6 total in the city of Houston, but as you well know, across the country, that number is over 1,000. So the city of Houston accounts for now 6 of that total number, and we want to continue to do everything we can so that that number doesn't increase and hold the line. So let me now bring up Chief Acevedo. You have your voice back?
Yes, sir.
Okay, Chief Acevedo.
Thank you, Mayor. Thank you. As of after this afternoon, we're up to 17 members of the Houston Police Department that have come back positive with COVID-19. I'm sad to report that the officer that I reported last night to be in the hospital is not on a ventilator. So as we always do, we ask that you pray for him and his family and everyone that's being impacted by this dreadful virus. On the good side of my report, we now have a second officer that has come back to work after testing positive for COVID-19. So again, we've had 17 employees, all frontline members of the department that have tested positive. 2 have been hospitalized. 1's already out of the hospital in isolation, and sadly 1 is on a ventilator right now. So we just ask for everyone's prayers, and like the mayor said, Dr. Purse said, what we need to do is, you know, our folks are out still doing their job. We all need to do our part by following the advice of the mayor and everyone else involved. So thank you very much, and I'll step aside for Chief Pena.
Good afternoon. So let me give you a quick brief on the status of the Houston Fire Department. As of today, we are able to staff all our apparatus. We do have about 173 firefighters that are in quarantine, which is putting an incredible strain on our ability to staff, but we are maintaining the full strength on the department. Of those 173 in quarantine, we've tested 49. 12 have come back positive for COVID-19. 2 of those have since recovered. So right now we have 10. And again, look, what we're doing with the physical distancing, with the staying home, all those things are going to allow us to maintain capacity in the 911 system as well as in the hospital system. So I just want to stress to the public that we're urging you to stay home before this thing hits home. So please heed the instructions. We're taking this day by day. We're able to meet the demand, but if we don't do anything to flatten that curve, as the term has been used, then we are gonna start stressing this system, the 911 system, as well as the hospital system. So, but for right now, what we ask is again, like my partner Art has said, we ask for your prayers for our first responders, for our city employees, and for all those that are working out there in essential businesses, because they are exposing themselves for the good of this community. So with that, thank you.
Thank you, Chief Pena. And look, let me just emphasize, every day that we can stay within our healthcare system ability to handle all of their patients, both for just the general beds as well as the ICU, every day where we can stay within their ability to handle is a victory. And that's how I characterize it. When they can take care of every patient that comes in every single day within their abilities, within their capacity, that's a victory. And so that's why they're going to do their part, within those walls. For those of us who are not in the hospitals, we can do our part by continuing to flatten the curve. And then, of course, both all our first responders, they're approaching the calls as if everybody in the city of Houston has this virus, which means, we are utilization rate of PPEs is very high. And so let me call on Chief Bunick, who's director of our Office of Emergency Management, just to make a special appeal for PPEs for the city of Houston. Chief Bunick.
Great. Thank you, Mayor. Thank you for your leadership. And we really appreciate City Council's support in helping us obtain this personal protective equipment. But I'd also like to thank our partners in this fight against this crisis: the Houston Police Department, the Houston Fire Department, the Health Department, and then also our Office of Emergency Management that's maintaining situational awareness 24 hours a day and helping coordinate all the city resources. As the mayor said, with donations, you can never have enough PPE equipment. Anybody that would like to donate masks, gowns, gloves, face shields, you can let us know about it at donations@houstonemergency.org. That's that's donations@houstonemergency.org. We're looking for PPE equipment to keep our frontline first responders safe. Thank you.
And let me thank Shanghai, China, because there are 21,000 masks that they offered. Those masks are on the ground here in the city of Houston and now within our possession. So certainly want to thank them for their donation. And quite frankly, we didn't have to pay for those. They donated them. So thank you so very, very much. Director Williams, we are utilizing our health department personnel. They helped to set up this shop. They have always been out there. We don't give them credit enough. So Director Williams, your comments.
Well, thank you, Mayor. I only have one message, and that is to those people who have actually gone through our screening process. We have a limited number of capacity at our Delmar and our Butler site, 250. So I'm encouraging those people who have gone through that process to please show up for the appointments that we've given you. We really want to maximize the utilization of our testing capacity. And I really want to express a public thanks to our public health employees who are out here at the testing site, who are back in our office doing the epidemiological work, that are following up on those people who have tested positive, doing our contract tracing to ensure that we're informing people to exercise either isolation or quarantine if you've had contact with someone who's positive.
Let me thank Director Williams, and I see we've been joined by Congresswoman Sheila Jackson Lee. I know she was instrumental in setting up another testing site in Northeast Houston. Congresswoman Lee, you want to have any closing comments before we start?
Mayor, I think what is important, first of all, is my appreciation to the city, your leadership, to Houston Police Department, Houston Fire Department, all the medical professionals, all the unnamed essentials that are working for the city in many, many places, sanitation workers. Thank you to our DHS representative. We thank you, Steve Williams, and council member, we thank you so very much for your leadership. The federal, state, local have to work together. And my charge is to continue to advocate for the city of Houston for the work that they are doing. And that is, again, that we're saving lives. As indicated earlier, we're going to be pressing the federal government to continue to provide the test kits, the FEMA personnel that is needed for the city and county. If we continue to do that, they will continue to be able to do their work. We want to make sure that Texas is seen as a state that is doing the right thing. We're a state and a local community that has not yet reached the epicenter. If we are to continue our work and be able to have a basis of diagnosis, which is the testing, then to be able to tell people to self-quarantine, to be able to eliminate community spread, then we will be a model for the nation. And I believe that we can be the model for the nation. So I want to thank the mayor. As you continue your work, my advocacy will be for you to continue to have the resources, the federal resources that are necessary for all of you, county and city, to be able to do your work.
Thank you. And let me say the council members have just been tremendous partners. I can't say thank you enough. And Councilmember Abby Kamen, you're chair of the Public Safety Committee, and I know she once was quarantined. She's out of quarantine, and so she's here. Councilmember Kamen, why don't you just say a few words?
Thank you, Mayor, and I echo everyone's appreciation for our mayor's leadership, for our congresswoman's leadership, and for our fire chief, our police chief, Chief Bunick, everybody that is serving on the front lines, including our healthcare workers. They are doing an extraordinary job under extraordinary circumstances. So we ask, please, for the public to continue to be vigilant, to practice social distancing, to stay at home. When you're enjoying our parks, please don't play on the playground equipment. Don't play with balls and other people. Do your part so that our healthcare workers and our first responders can do their job in taking care of us. And I'm so happy, Mayor, that we now have this testing site open. We will continue to push our federal government to get us more of what we need so that we can take care of our residents.
Okay, we'll take any questions that anyone may have.
Yes, Mayor. The major risk groups, which are those in prison and the homeless, we really need input from you and the people taking care of them. I've been telling some of us that they are not getting the mask and other things. I know that Dr. Paz had a press conference with the Coalition of the Homeless. But we went out there doing the follow-up work that we are supposed to do, and they keep complaining that they do outreach and they don't have the mask. So how are you actually working to take care of these high-risk groups, those in the prisons, and Mayor, some of those are people in your county jail? The federal government talked about federal prisoners who may not have long-term to be in jail to be released. So what are you thinking? What are you thinking about?
Well, with respect to the jails, the county is handling that aspect of the program, and so I'll defer to the county and the Harris County Sheriff Department and the Harris County Commissioner's Court with respect to the jails. With respect to the homeless population, we are working with our homeless coalition partners, The Way Home. We are providing them with personal protection equipment. We always need more. especially to those who are servicing our homeless population. They too are on the front line, and we want to make sure that they have what they need. We are working secondarily, for example, to thin out the population of our homeless that are within shelters, and we're working with the faith-based community to do just that. With respect to those that are on the streets, we are working to get to them sanitizers, the things that they are needed to keep their hands clean, and trying to provide them with the other things that would make them safe. And as you know, on yesterday, City Council approved the leasing of 2 hotels. And if they are needed to be tested, or if they have been confirmed to have COVID-19, we will use one of those hotels to house our homeless and to keep them there during their time when they would be contagious.
Mayor, some questions from the pool. From KRIV, they're interested in knowing, several reports have suggested that Texas is the next hot spot following Louisiana and the East Coast. Your reaction to that, and do you think we need a tighter lockdown than what we have already?
Well, we have already taken some aggressive steps, and we didn't just start that. In the first week of March, for example, the CERAWeek, the big energy conference, that was canceled, as well as some other conferences as well. In the second week, as you know, we ended the Houston Livestock Show and Rodeo, big deal. That was on March the 11th. In the following week, March 17th, is when we put the prohibition on our restaurant, bars, and clubs, with the exception of being able to take out and delivery items. In the fourth week, on March 24th, is when the stay home, work safe order was put in place. And then on yesterday, instructed the Parks Department, for example, to take down the rims, basketball rims, or to block off our basketball courts. And then we are dispatching Houston Parks and Recs to our parks to ensure that people are complying with the social distancing. So I think we've been pretty much aggressive as any of the major cities, and we've taken steps even when our numbers were very, very low. And when you look at our numbers and where we are, I think we're being successful. So we just need to stay at it, and it's the responsibility of everyone. If everyone does their part, we will. But I do want to thank Houstonians for complying.
What about the mask issue?
Let me just add something to that, because all of that is being discussed with people who are on the federal level. From the federal level, this city, county are being stupendous, and the cities that are in the state of Texas, they have been proactive, which is why we're where we are today. They have spoken about symptoms. They have spoken about staying in place. They have coordinated with county and city government. They have public-private partnerships, not only from those private centers that are open, Forest Brook open today, but the Texas Medical Center. That is a very unique partnership that is evidencing that we are not moving toward being the epicenter that we've seen in other cities. We pray for them, but if we continue at this pace, what the mayor's work is, the stay-in-place order or stay-at-home order, I think that as long as we're getting a diagnosis through testing, I believe that we're on another direction. That's why I said that we can be a model for this nation, and I pray, Mayor, that that will be the case.
Mayor, also, some of the stations want to know about masks. City of Laredo and Los Angeles have come out saying members of the public should wear some sort of mask when they're out and about. We're seeing more and more people wearing masks here. Is that something you would recommend to as they go to grocery stores and things like that? And if so, do you have any preference as to what they should wear?
The instructions coming from the CDC and from our partners at the top level. They keep adding to what we're being told, being advised. Initially, it was said that the masks were not helpful except to those who are already sick. Now it seems to be they're saying that it may be helpful. So basically, I say to people, if you have them, fine. If you have them, use them. But until we get a more definitive answer, it's not where we are saying you have to have them. And then we also know that N95 masks, KN95 masks are in short supply. Surgical masks are in short supply. And my number one priority is to make sure the healthcare providers, our first responders, have what they need so that they can serve the general population.
KRIV has a question. I guess you made remarks on Sunday telling criminals and crooks to chill out until it's over. And I guess those remarks have gone viral. Would you like to speak to that? What you meant when you told people to chill out?
I meant what I said, and I said what I meant. No further comment is needed.
And do you have any, this is from KHOU, do you have any unemployment numbers came out today nationally? Do you have any figures as to how many jobs were lost in Houston due to COVID-19?
That I don't know. Based on the reports that came out on the national level, the number of people who filed for unemployment benefits has doubled from what it was the last time. Now it's 6.6 million in the entire country. I'm sure there are literally hundreds of thousands of folk in the city of Houston and the state of Texas.
Mayor, a couple questions from KPRC. First, this one is from my colleague Mario Diaz. Mayor, you have indicated that we will need to work together during this time. We've heard the talk about sacrifices that need to be made. This said, at a time when we see tolls suspended, what is your position on the medical center continuing to charge personnel to park during this pandemic? He also has a follow-up too, but
I don't know if I'm in an ability to speak to that. I would refer that comment to Bill McKeon, who's over the Texas Medical Center.
certainly. And so, were you aware of the issue, and has your office reached out to the medical center about it?
No, but this is the first time anyone has approached me.
And finally, have you given any instruction to utilities that are going to work right now that say that their work requires them to go inside people's homes where their people or families self-isolating? Can you put a stop to this type of thing?
Well, the reality is we're asking people to stay at home. Utilities is an important element that's needed to stay at your home. Your lights, your gas, your water. That's why we have excused, for example, exempted plumbers, electricians. You know, you can't have people stay at your home if you don't have access to your water and your power. So it's a delicate balance. I think we're going to pick this up maybe on the inside. I think Mother Nature is having a better say.
Are we good? We just need to talk to, we have a few questions to the chief. I didn't know what the best...
Well, he can do it separately. So we're going to do it separately because we're going to start the tour and then we're going to...
No, it's okay.
Thank you all.
Mayor Sylvester Turner and other city leaders there. In addition, Congresswoman Sheila Jackson Lee giving us an update on what's happening here locally. This is taking place here as the rain starts to come down at the city's second testing site, second city-run testing site at Del Mar Stadium there on Mangum Road. So that's where it's happening. See the tents behind there. That's where folks are driving in. You can get a test there. Anybody can. If they've been pre-screened and they're showing symptoms, they can get a COVID-19 test there. So we got some new numbers here from the city. Just going to run them down real quick before we get you back to regular programming. 48 more confirmed cases. That is just in the city of Houston. 506 total now. Unfortunately, 2 more people have died, a person in their 60s, a person in their 70s, both with underlying health conditions. That brings the death total in the city to 6 people now. They're still expecting a May 2nd peak, so that is 1 month from today. That is when the virus will peak in the city. And the mayor said the whole goal here is just to make sure that hospitals can continue to treat the people who are coming in, not to overwhelm the system with too many patients. That's the whole flatten the curve thing we talk about so much. The police department, 17 Houston police officers have tested positive. Unfortunately, 1 is seriously ill on a ventilator right now, but 2 of those officers have gone back to work, so they have recovered. That's good news. The fire department, hearing from Chief Pena, 173 firefighters are quarantined right now, possibly infected. They have not been able to test all of those firefighters yet, but the ones they have tested, they have had 12 come back positive, 12 firefighters, 2 of those have recovered. So according to the chief, 10 active cases within the fire department right now. That's the latest from the city of Houston with the COVID-19 outbreak. We're going to get you back to Ellen right now. We will see you for the 411 coming up here in 1/2 hour.
As well as parent resources and tools. Our school districts are here for you. Visit gopublicgulfcoast.com today. Follow us on Facebook and Twitter for updates.
This is the kind of card that has America talking. With it, people with Medicare are getting all-in-one coverage for their